This episode of Friends of Flo is brought to you by NCLEX Mastery. If you're a nursing student and you're about to take your NCLEX, you need to go to the App Store right now and download NCLEX Mastery.
All right, so welcome back to another episode of Friends of Flo. My name is Tess Judge Ellis, and I'm surrounded by my colleagues and friends, and we have a guest today, a special guest.
Our special guest, I'm Rebecca Porter, and our special guest today is BJ Hannnon.
Hi, BJ.
Hi.
I'm Andrew Witters, by the way, and good to see you here.
And if you haven't listened to Friends of Flo, we are a podcast we are designed to empower nurses to be leaders and encourage them to be leaders in healthcare as we move towards true healthcare reform, where nurses are going to be the leaders and so having a voice is important.
And we've been friends Tess and I have been friends for a
20
long
plus
time.
years,
Yeah.
since we were baby nurse practitioners in the last century. And then, of course, Andrew and I have known each other for quite a while.
And BJ and I have known each other for 5 or 6 years.
So what's the topic today, guys?
I think we're going to talk about intergenerational issues at work, and BJ is our expert in this.
So we were able to reach out to folks and ask questions about what they wanted to listen to, and we found a lot of chatter online, didn't we? And
That's
about kind of nurses being mean, or maybe the issues related to intergenerational and issues in nursing. So you're a baby boomer. Let's say you were born before 1965, and now all these millennials who were born in 1995 are entering the workforce.
1980.
1980 is in particular.
1980.
Okay, yeah, they were born in 80. And so, BJ, you've done a lot of work on that. So
we're Generation X. I'm getting all confused. BJ, define all the generations.
I can do that for you. First of all, I just wanted to share why I am interested in this subject.
Yeah, start
Please.
there.
It was fairly accidental, actually. And about, I'd say, 12, 13 years ago, with our chief nursing officer, we were looking at the demographics in our Department of Nursing. And like a lot of institutions, we noticed that we had a large number of nurses who were in their early 50s. And we were very concerned that if these older expert nurses suddenly decided to take early retirement and walk out of this hospital, we would have some issues with a lack of expertise and leadership. So my job was to put together some focus groups with older nurses, 50 and older, bring them into these groups and basically ask them, what can we do as an institution to keep you working longer?
And what year was this? I mean, just for context.
That was about 12 years ago. I believe it was about 2003 or 4.
Okay.
That we were doing this. And we were not unusual. There was just a large cohort of nurses. And back then, people took early retirement.
Right.
57. We don't see that very much anymore. But anyway, I was fairly inexperienced with doing focus groups, and I brought these older nurses in and asked them what we could do for them to keep them working longer. And it took these nurses, who I had for about 60 minutes, let me tell you, it took them about 5 minutes to tell me, we do not want those high bar stools. It's hard on our knees. We need more bathroom breaks in the OR because a lot of us are on hydrochlorothiazide.
Wow.
We want larger fonts on the all these things. We don't
Functional
want
stuff.
carpet.
How's classic nursing,
We do
right?
not want carpet because it's really hard to push carts across carpet. Well, anyway, and I said, great, anything else? Now, understand, I had them for 55 minutes. These nurses were in their 50s, and they began to unload on a lot of new nurses, saying, I'll tell you what's going to make me leave. Not the font and the computer, but all of these new young nurses.
And what part of it?
Interesting.
What
Yeah.
part of it?
So, yeah, what
So a
specifically?
lot of it had to do with concerns about the art of nursing.
Oh,
Meaning these were older nurses who felt that a lot of these young nurses were only sort of technically oriented. They really did not understand much about comfort and how you really physically care for patients. That was one issue.
The hands-on
Exactly.
part. Like you and I learned to do bed baths.
No kidding.
Exactly.
And nursing, yeah, they do nursing 101, but it's not stressed.
It was, I remember one quote from a nurse, one of our older nurses, who said, if I have 2 days off, I know when I come back, one of my patients that I had 2 days ago, nobody would have ever shaved them or cleaned their dentures.
Right. Or even organize their bedside table.
Exactly.
Right?
Exactly.
So Andrew, you're younger. I mean, quite a bit younger than we are. Did you learn how to make a occupied bed? And
That was part of the didactics.
Like skills 101, right?
Yeah, that was part of the didactics in the nursing program. But I
did you have a lab? Like we had nursing labs.
Yes, indeed.
Yeah.
We
where
had
you
a
learned
lab.
how to do all that,
that.
and then we still went into patients.
But it's so high tech now.
Well, I was just going to say, I do think that once I got into as a professional, once I got licensed, I think as a new person, there is this pressure that you feel to just update yourself with all of the technology that surrounds the care of a patient. There's sort of a hyper focus on that, perhaps, versus doing some of the more remedial bedside routine stuff, which is obviously still important.
Right, but the word remedial, I think, is
well, and it's not remedial. You're right. You're right.
issue.
It's but and I'm not defending like any new nurses for a lack of shaving a patient or doing denture care or anything. But what I'm saying is I think that there is a pressure that young people might feel coming in, who are brand new nurses coming into the profession, that there's sort of an undue balance between doing what a patient needs, which is the hands-on care. And don't get me wrong, I think that patients do need hands-on care, but there is this pressure.
I hear you defending the nurses, and I don't mind that at all. But it's honoring the intimate space.
Absolutely.
In nursing. Do you know the relationship that goes into like the basic needs? And it's that I think it has to do with the expertise of the 50 sons.
If I can
what do you think? You can interject.
comment here.
Please comment. And I'm not defending.
I think that we know that there is a very big body of evidence out there right now in the literature about something called missed nursing care.
What is
missed nursing care.
Oh, yeah.
And one of the researchers who has researched this subject indicates that in modern nursing today, we have some cares that are disappearing and missed. Number one in that is the bath. Number two is ambulation. Number three is nutrition. Number four is like oral care. Number five is night care. Remember when we used to you put people to bed
we went
at
around
night.
and we had a cart
that
we walked around with at night, and we would back rubs and
I don't think
care.
they teach back rubs anymore.
It's not just back rub. It's make sure that they have their sleeping pill, that their room is, you soften the lighting, it's something that we used to call night cares. But the point of this is that this is something older nurses did because there was no one else to do this. There is among a lot of our new younger nurses an idea that this is not their job. This is the job because they are assessing and managing the patient care. The research is telling us that a lot of new young millennial nurses see these issues as the job of the nursing assistant. We don't ambulate patients because that's the job of physical therapy.
Well, but it's very laborious though too to
what you're talking about is the actions are laborious, but it's that
space of getting in with the patient. And I can tell you from the times of the hundreds of bed baths that I gave patients over the years, the intimacy of that care, of that time, the things I learned. The assessment, not only it's the assessment, but it's also the skin assessment of knowing, but also the time of having your wet hands on somebody's body, and you're washing them, and the intimacy of that, and the things that patients will tell you.
Right.
In that
assessment
quiet
too. I was talking to my mom about this, and she said, "Remember the days when
your
you
mom
didn't
was
have." Yeah, I mean, I was almost invited her to come here because she was just in town, but and she taught nursing. She said, "Remember the days you didn't have a stethoscope." You didn't have like the ability to take a blood pressure because she's, of an age, she's in her 70s. And she said, you walked in and you looked at the patient to see how they were doing.
Indeed.
And that was it. You didn't go by the monitor. You didn't go by the blood pressure and the temperature. You say, how is the person doing? And some of that is learning their patterns on an intimate basis by walking with them, by looking at them. I mean, anyway. But go ahead, BJ, because
I will say that there was, you might believe this too, Rebecca, there was a certain sense of pride as a nurse that my patient was sparkling clean and up in a chair, and their family was coming.
Table was organized,
right? But
mean,
you knew their family was coming in at 10. In those days in the ICU, Andrew, people, we opened the ICU every 2 hours for 10 minutes for family.
Really?
And we would, really, buff and puff these patients, so their family buff and puff these patients. But I think from a millennial standpoint, these are things that a lot of our young nurses feel are
below them.
I don't even know if it's below them. I think they prioritize.
I think it's a priority.
And the bath and things like that keep getting pushed down the list. One thing that concerns me, because I do quality work and concerned about falls, is, it used to be if a physician ordered ambulate TID, you ambulated that patient three TID. If you got busy and it was time to go home, you still ambulated that patient. That was an order. Today, there's a lot of younger nurses who may not see the value in ambulating, and if physical therapy is not there to ambulate their patient, it gets missed.
That is so...
It gets missed, not understanding that's the number one cause of deconditioning. And
pneumonia.
Exactly.
And pneumonia.
Falls and pneumonia. Yep. And it may not seem like this big, huge treatment. It's just walking your patient in the same way, turning your patient.
Positioning's huge, isn't it? Positioning.
We don't do range of motion anymore.
Really?
Do you remember?
Right. Oh my gosh.
Yeah.
So what you're speaking about is some degree of the hierarchy of needs of a patient that are arguably being missed. And so I just want to expand on that thought, because I think that you're right. I think there is a culture of missed cares and missed priorities. I see it outside of the hospital setting, even in nursing homes, where you have a geriatric population that is susceptible to bone demineralization, muscle weakness, pneumonia, because of what you had just mentioned. Ambulation, range of motion,
socialization.
Socialization.
So
and I will
when
add
those
to
things
that,
are,
Andrew.
Yes, please.
Malnutrition.
So
there's a lot of
absolutely.
younger nurses that if there's not a nursing assistant or a family member around to feed this patient, in our world where you do all of this a la carte food, you may. These patients don't get fed.
So in Ireland, sorry, Andrew, go ahead, finish your talk.
So this is a pretty. So we're chewing on a big global subject here on terms of like of what is being witnessed in nursing. So as someone who has been in the profession, as you previously mentioned, for decades, what is a solution that you might give to some new nurses, especially the new nurses that are coming in who might be a little timid, they might be shy, and perhaps they might be concentrating too much on monitoring, like on terms of like actual looking at the monitors, looking at just the numbers, lab work. What would you advise to a new nurse, and that to also help mitigate that behavior while also catering to the needs of
that tension. The tension. That's
because I think there is an obvious tension.
Oh, I know there is a tension out there. And I think one of the things that we have done in nursing is this compartmentalized care. And there are, on our units, at our hospital, our big med-surg units, clearly bathing patients is the job of a nursing assistant. It is in their job description. So if you do not have enough nursing assistants, the bath does not get done.
So I have to tell you that the number of times I've been on units walking through, I frequently see RNs sitting at the desk, and the nursing assistants are scurrying around like headless chickens and looking haggard and tired and worn. And it's not that these RNs are busy doing data collection and checking data on a computer and looking at things. They're sitting there doing their nails. They're sitting there gossiping. They're on their cell phones looking at pictures of one another on Facebook and Instagram. And I just kind of see that because I see this attitude that that's not my job. I don't do that.
I have a little different viewpoint on that. And that is,
please share.
Having been a nurse for a long time and seeing computerized charting enter our world,
yes,
and computerized documentation, it was going to save the nurse time. It was going to save the nurse a lot of time so that they could spend more time at the bedside. I will say that one of the biggest complaints from a lot of our nurses is the absolute time it takes to do computerized charting.
Oh, it's for everybody.
It takes a long time.
Yeah.
You know, when I was first a nurse, everything was on paper. And we used to carry around little clipboards, right? And then you'd sit down and you would narrative chart and from your notes all day. But these nurses are documenting constantly in multiple sources. We know, as someone who works with error and quality issues, we know that a huge amount of our errors come from failure to document or incorrect documentation. Here's a really unique example, is that we had a patient who came into our emergency room and had what looked like a PICC line in their anacube, in their right brachial anacube. It had little pigtails on it. Looked like a PICC line, smelled like a PICC line. It was not a PICC line. It was a midline. And somewhere along the way, the ER nurse knew that, but she failed to document it in the record. So everybody lives off the documentation of the record. This patient was transferred multiple units.
So no
and everybody
with no confirmation of the assessment.
And it was just, you read in the record, it says it's a PICC, and then the patient was ordered to be given vancomycin through a central line. It was given through a midline because it was a failure to document correctly. People are so overburdened with documenting that we do a lot of this copy and paste forward.
Yeah,
if someone
absolutely.
makes an error in copy and paste forward, it just gets continued and continued. So one of the problems is that because of the burden of documentation, it is easier these days to copy and paste an assessment from someone else rather than do your own.
Yeah, we do.
And what happens is that in the original assessment, there's an error.
You're just saying is, and then reassessment's not done.
Exactly.
So in my language, in my storytelling way of doing things, I call that chart lore, L-O-R-E.
Yes.
These
chart
stories,
lore.
Yes.
chart lore.
Chart lore. We're going to hold off on that and pick this up, the chart lore.
Here at NCLEX Mastery, we love nurses and especially nursing students, but we need your feedback about this podcast. If you have ideas on topics or you have questions you want us to answer, shoot us a message, leave a comment, go to our Facebook page, and just tell us what you think, because we want to help you in the most specific way that you need that help. Thank you so much.
So now we're back again and I'm Tess Judge Ellis.
And I'm Rebecca Porter.
And I'm Andrew Witters.
And you're joining us for Friends of Flo on
with
our
podcast.
Guest,
with
and
our
we do
guest.
have a guest.
With our wonderful guest.
So I wanted to go back to the original thought was I brought in all these older nurses, and this was their complaint, was this lack of art of nursing. So I listened, and there were lots of other concerns. One of them had to do with younger nurses and scheduling, work-life balance, kind of this, what do you mean I have to work these hours? What do you mean? Oh, I don't think I want to do this. And then there is these older nurses also, I'm pulling off the themes here. So it bothered them that they appeared not to be willing to do, schedules that they used to have to do. And I do know from generation to generation, there is this passing on of suffering in nursing, right? I worked 10 years of straight nights. Sure. You have to work 10. So there was that complaint. And another complaint was this desire to not be a bedside nurse. Well, I really don't need to learn that because I'm going to be a nurse practitioner. I'm going to be a nurse anesthetist. So I really don't need to learn this. So these were kind of the big three themes from older nurses. Lack of flexibility in scheduling complaints, work-life balance, my home life is way more important than, the schedule I'm working, which of course to baby boomers was not it was unheard of. And the other was this, I really don't want to be at the bedside very long, so I'm not going to really invest a lot of time. So when I did a theme analysis of this and got leadership together, we immediately understood that we needed to talk to younger nurses. So I put together 5 focus groups of nurses between the ages of 22 and 25 to ask them, how they perceive the workplace. What I got from a lot of the younger nurses was we feel bullied, harassment. They, meaning they're not nice. They won't help me. They don't understand that I'm not ready to come off of orientation, that I need a few more weeks or months. They give me jobs that I'm clearly not ready to take on. All of this, and from my standpoint, having conducted these focus groups, I looked at all this, talked to our chief nursing officer and said, there is something going on here. Definitely. Not that I thought that we all come to work every day holding hands, singing Kumbaya together, right? Yeah. However, I think I was unprepared and our chief nursing officer was unprepared for the level of this little bubbling turmoil under the surface that was clearly generationally based. That was the source of it. It was a very different viewpoint about nursing coming from a very different perspective. And I struggled with the profession of nursing, trying to find webinars, information, conferences on intergenerational conflict, specifically in nursing. Now, I will tell you, I have learned oodles and oodles of information from the business world. And in fact, most of the conferences and webinars that I have listened to come out of business and industry, not nursing.
So what have you got out of all this then, and how do you think we ought to move forward?
Yeah, how do we mitigate all this? How do we mitigate all this tension?
Well, one thing that people, in my opinion, have to do is understand that we are all the products of the times in which we grow up
and the places
and
that we're from.
To maturity. Different times, different influences, all kinds of things make us very different.
So talk about the influences from like the older or you can finish your thought.
Well,
really
my thought really is that this blame has got to be removed.
Yeah.
Sure.
It is, baby boomers tend to blame millennials and say they have no work ethic.
Mm-hmm.
That is not true. When I look at our young millennials, they are bright, they are well educated,
they're great, aren't
they are
energetic,
visionary, they are massively IT able. They are great workers.
And I see them as caring people too.
They are. However, in looking at the literature and the research out there and the work that I have been involved in, there's a little bit of a caveat here with millennials, that there is a little bit of need that this needs to work for me. As long as this is a job that works for me, that, is going to bring me what I need, they're very willing to work. But models from business and industry tell us that this is a generation that needs a lot of reward and recognition. They need to
got
be
all trophies.
They are the trophy generation.
Everyone got a trophy, right?
It is
a great analogy.
Interesting when you look at millennials. They are the children of the hardest working generation in history. The baby boomers, work, work.
Everything for work.
And
Right,
they
well, and I
did
can
not
do everything. I can raise a family.
exactly
I can be this way. And
the best nurse ever.
Right.
But they did not raise their millennial children with the same values. And it's problematic because baby boomers who get very upset at some of the behavior of millennials, which is pretty much, well, I don't think I want to do that. Well, I'll just quit and try something else. No,
Sure, I'll go to grad school. Mm-hmm.
Yeah, I'll go to grad school. Oh, I'll just do a different.
I'll go to a different place to work.
A lot of this quit behavior. Baby boomers never quit. Why didn't we quit, you guys?
Why are we at the same place for decades?
Because the whole baby boomer system of seniority, if you quit, you lost your place in line. And besides the fact, I think a lot of baby boomers were brought up in an environment where there was a stigma about quitting.
Oh, yeah.
But we have a lot of millennials who a lot of their behavior, I am sorry to say, is from their baby boomer parents.
So what do we do? So what advice do we give to the millennials who are listening to us and the boomers that are listening? So
for boomers, my message is, at some point, baby boomers, you need to stop helicopter, hover, fixing, making things all work, for your, for young millennials. This is a habit of baby boomers, is that we tended to get in there for our children. And there is nothing wrong with parents who want a better life for their children. I am going to do everything for my child. I'm going to make sure they have all the advantages and resources and positive reinforcement.
Right. So
everything I can do.
Stop, right?
So the boomers really have to stop interfering.
How does that work in the workplace?
In the workplace.
Especially in a culture where it is to be patient-centered, and at times it might be even rescuing a patient in clinical situations. So that's a
well, and even just getting along, so there's not so much of that, because you can't rescue a patient if your team is not effective.
Exactly. Yeah.
And
sure.
if you've got
absolutely.
this kind of tension
and harassment and bullying and prove yourself and show me you can be. Our suggestion at our hospital, we had no idea that there on some of our units, you guys, there was a culture of bullying and harassment, proving yourself. When we created our grad nurse residency program, was our first chance to really talk to these new young nurses and say, how's it going on the floor? I think we had an idea when we started seeing lots of contract transfers. Why do all these new young nurses want off this floor? We went in there and did a lot of work and looked at the culture.
Leadership.
It was nursing leadership. And we really, I will say that we offered early retirement to some of the older nurses who were doing this nurses eat your young kind of stuff.
Yeah. Mm-hmm.
That has to be rooted out. And number one.
Named.
And you need to stay on top of, the days of ignoring stuff on the floor. We realize that conflict among nurses impacts patients.
Well, it's directly linked.
And we did a lot of work, me personally, with lots and lots of group dynamics on the unit.
It sounds like you also had your CNO on board, too.
Absolutely.
Yeah, and then nurse managers had to call it what it was.
Absolutely.
And recognize how it was impacting
outcomes. I will tell you, we needed the CNO because absolutely some of our very old baby boomer nurse managers had to go.
They had to go.
Yeah.
And they had to go. And it is difficult for baby boomers who grew up in this seniority tenured system to tell this nurse who's been working 34 years and is the manager that we can't let you do this anymore. So from a millennial standpoint,
yes, what did you
this
do
is
for the millennials?
this is
Yes.
difficult. First of all, I just want to touch again on this blame idea. You know, that boomers blame millennials for what they consider a poor work ethic, you know, which is, it's not a poor work ethic. But if you Google poor work ethic in millennials, you will get article
Of
that they
course.
don't want to work. You know, they see this complaint about scheduling or this. There is a phenomenon in nursing, which I'm sure Rebecca and Tess don't ever remember. People worked full time. Maybe you knew somebody who worked half time, but this 0.6, 0.7,
No,
0.8,
no,
0.95,
no.
0.4, and they change all the time. You know, I'm going to work for
Yeah.
a while
I
and
can't imagine being a manager nowadays.
0.9,
and have to,
and you know, 2 months later, I'm going to go back to school and I need to go 0.7. Well, anyway, this millennials, I think, need to understand that this is a team. This is not just you out there. And when I work with young millennials in the grad nurse residency program, they tend to want to say, this doesn't work for me. And you need to really redirect some millennials back to, this is for the patients here.
It's called
This
continuity of care.
This is, if you are going to do this job, we're asking you to focus on this job. I get that you're on the 5-year plan to get your DNP,
right,
you know, but
right
now you need to really focus.
Socialize them
Socialize.
back to the team. And the
One of the
patients.
things that we see in new young nurses is they are afraid to admit that they may not know something. We are trying to create a culture, which you need to do, that it's okay to say, I don't know how to do
Good
this.
Heavens, right and left.
You
I have
know,
to say that.
you do, but you know, coming from a culture where nurses continually had to prove themselves. Nurses eat your lung, figure out how to do it. We need to make sure that baby boomers understand.
Well, we were all new once.
Exactly. And the complexity of nursing care today is, of
it's not for
course,
wimps, that's for
different than it was for me in
Totally different.
1973.
Yeah.
In 1973, I had to learn 5 antibiotics.
Right.
There's a gazillion. You know,
Right.
we have to understand that they are not us, that we cannot. There was kind of this thing with baby boomers. How do you get a good nurse? Put them on the night shift with 30 patients and one nursing assistant.
I did
By
that.
golly, they'll learn to be a nurse.
Right.
That's what I did.
Nurses eat 30. We cannot do that.
So I'm just going to circle back and just say that, you know, it sounds like it's you guys have recognized the issue through the focus groups and listening. Right. And then you've created you've had to acknowledge it from a manager standpoint. Call it what it is. Weed out the bullying people and the leaders that were bullying. You needed support from your CNO. And then you've addressed the culture and the team environment and changed the young millennials kind of perspectives.
Right.
And
I would add to that, it's not all about the millennials. We do understand totally that one thing that creates another bit of conflict on the floor are the older nurses, who you guys kind of did the baby boomer mantra, which was stay the course, pay your dues. Eventually you will be rewarded. What's happened is that there are a lot of nurse managers out there who are fearful that these young millennials are going to quit.
Yeah.
So they
overcompensate.
They tend to overcompensate and give them, you know, the hours they want. And who loses out here, Rebecca?
Yeah. Exactly.
Who loses out?
The boomers.
The boomers,
Yep.
you know, who are saying, wait a minute.
I've been doing my time here.
Right. And there needs to be a balance. And nurse managers or whoever's doing the scheduling needs to understand that millennials can't have it all. That we really need to support our older baby boomer nurses who are feeling a bit left out in this fear that we're going to lose the millennials.
Sure, because it's also like like what I've noticed, because I'm more of a Gen X person, and so it's what I've noticed is that everybody gets an opportunity to shine. And if you're going to ignore the Gen Xers and the younger baby boomers who are still in the workforce, then you have to recognize the merits, of everybody and the strengths of everybody, and find a way for everyone to shine on the team. And then of course the millennials are very important. And also so is the other folks on the team, and getting that. It really takes your strongest nurse managers to
create that atmosphere of inclusion and respect, and taking the time to acknowledge, like you said, Tess, of everybody has something to offer.
Everybody gets a trophy, and
everybody. That's a good point.
You can, sometimes it's a self-determined trophy. What do you want your trophy to be right now? Do you want your trophy to be the fact that I can count on you every time? And so, you know what I'm saying? Like that work ethic, I can count on you. And so how are we going to reward that, either monetarily or with scheduling? Or is it going to be the I'm on this committee thing? Or is it recognizing that, you know what, I noticed that you always have done this with a patient. That kind of, that's a great, that's almost like doing rounds.
Right.
Do you know what I'm saying? And being on touch with patient care.
Right.
So,
I think you're bringing up some really reasonable social expectations from both the millennial and the baby boomer generations, and I'm using those labels just generally. But on a positive note, in your experience, BJ, could you tell us what a more experienced older nurse might learn from a younger nurse, and vice versa, what a younger nurse can learn from an older nurse?
Or things you've observed, actually.
Oh, so
just on a positive note, though.
In a positive note, I just will tell you from my own experience is that most baby boomers like me are self-taught for IT, for instance.
Sure.
Okay. And I, as a quality, person, I manage some pretty big databases, Access, things like that. I had to learn. I absolutely just crave help from some of our younger quality people. On the other hand, and they help me, and I am not embarrassed to ask or anything like that.
Well, none of us should be as
and
nurses.
I think the value of learning from them, this is very, very interesting. We have these bright young millennial nurses who are all about creating apps. All of our nurses, all of our nurses carry neutered iPhones, the Volt phones. They are neutered iPhones, but they have the ability to you can't get on the net on them, but they have the ability to be loaded with apps. And we have such tremendous ideas from our young millennial nurses on doing an app. Then we have older nurses who are anti-app, but then they see the value and are like,
oh, then all of a sudden,
and then all of a sudden our older nurses are like, wait, this is really, cool.
So you can observe that.
Oh, I see that a lot.
Can celebrate those things.
And we celebrate that. Mm-hmm. And one of the things that we do is we do a lot of recognition. We encourage poster presentations. Here's my app. Here's what I thought to do. Yeah. We have a lot of, we have a nursing quality forum, which is once a month. And every single unit in our hospital has to present a quality project twice a year. And we are encouraging our young millennial nurses to get involved and do these projects. And when it seems to me, when we have a bright new young nurse doing a project, they're phenomenal. I mean, how do we count those sponges in the OR? I've got a way to figure this out, how we can do this. And a lot of it involves technology. So that is what baby boomers need to help. Baby boomer nurses who struggle with epic documentation, just ask one of the new, young nurses.
How to do it easier.
One of the native users.
Exactly. However, on the other hand, especially when I work with the new young grad residents, you need to really help them understand the wealth of expertise of the older nurses.
Absolutely. Yeah.
The older nurses, and creating, now that we have weeded out a lot of older nurses who kind of weren't into that, I'm going to help you. The stories, we do stories all the time. We do, in our grand rounds, we do nursing stories. and the kinds of
We
things
need to tell our stories
that older nurses can do. What I hear from younger nurses a lot is, oh my gosh, I work with Loretta. She's unbelievable.
She
knows. Here's what she knows. She knows how to get what she wants. She knows how to go around, under, over, behind, all of this stuff and get what we need. So if you can create, it takes a remarkable nurse manager, assistant nurse manager, who can really bring your generations together. The worst thing, in my opinion, a nurse manager could do is do CLEX scheduling. By that, I mean letting all of your older nurses work weekend option nights, right?
Right.
I see, yeah.
Or letting all the new young millennial nurses work 7 to 7 or 3 to 1. You have to be really careful, and you need to really make sure that you are mixing nurses, no matter how much all of the Generation X nurses want to work weekend option nights together. That creates already
Us
from the
them
get-go,
kind of a thing.
it creates an us them. And then when a new young nurse gets put on that weekend, the conflict, you can just see it. The cliquey stuff begins. So I believe, we let people do self-scheduling. How's that for a baby boomer? What do you think, Rebecca? Oh my gosh!
I wouldn't know where to
Self-scheduling,
start.
I never had to do that.
So
Have
you found team building?
We're at about we're at a good spot to take a break here, as we just started. We're talking really into the intergenerational and going into solutions. So we'll take a quick break, and we'll be back.
Here at NCLEX Mastery, we love nurses and especially nursing students, but we need your feedback about this podcast. If you have ideas on topics or you have questions you want us to answer, shoot us a message, leave a comment, go to our Facebook page, and just tell us what you think, because we want to help you in the most specific way that you need that help. Thank you so much.
And we're back now, Friends of Flo. This is Tess Judge Ellis.
And I'm Rebecca Porter.
This is Andrew Witters.
And we have our friend BJ Hannnon as our guest today.
And we've been having a good time talking about intergenerational related issues and conflicts, socializing nurses. And so we had just asked BJ and we were talking about teams and really the qualities and characteristics of what she's seen in really successful teams.
Or a unit.
And units that are really successful. And then even literature that supports this kind of stuff, outcomes and those sorts of things. So take it from here.
So I was going to detail one of our units that has been very, very successful in team building. I would say when I look at their nursing satisfaction data, it's a very high functioning unit, high satisfaction, fairly low turnover.
Why is that?
We survey every year. It's a massive survey.
So what makes their unit, what's their leadership like?
This is interesting. The manager of this unit is a Generation X. These are workers in their 40s. So this manager is neither a millennial and not a baby boomer, which is helpful. She does have 2 young millennial assistant nurse managers. But the culture on this unit was, when she took over, fairly uncomfortable, high turnover rate. And she did a lot of team building from a multi-generational nurse force. Older nurses. What she did is, first of all, did a lot of interaction, meaning not just huddles, but a 1 hour every week. Let's talk about our issues. And she was very willing to put every issue on the table.
Very confident person.
Very confident. And she was, I think, because she was Generation X, she was not there. A lot of the younger nurses thought the nurse that was their nurse manager before was a boomer, of course, and always sided with the boomer nurses. So from the get-go, she was determined to stop this, sides and cliques and all this. And she let the older nurses talk about their experiences. I was asked to come up and do this little talk and it started the conversation. And there were a lot of young millennial nurses who did not understand that older nurse that they didn't really pay much attention to had been working for 35 years, had worked 20 out of
Which
the
is
last,
more than their lifetime.
30 Christmases,
Yeah.
who really had worked hard, and they never really stopped thinking about themselves long enough to think about it was Clark and how long he had been there. And suddenly the nurse manager, instead of doing the hours herself or having an A&M do the hours, they created a staffing committee to do the hours and the scheduling.
They had to work together.
And they had people who work nights, people from each generation who had to work together to do nights. And actually, this committee, which had a lot of younger millennial nurses, thought, and this is unbelievable, that some of these older nurses who had been there for 30 years maybe should only have to work every third weekend.
So they came up with solutions.
They came up with solutions.
Yeah.
The older nurses were so grateful that the younger nurses really cared that they had given so much to this, then turned around and said things like, you know what, if you do need a day off, I will do it for.
Of course, yeah.
It was instead of being
an us and them.
They, so they also, this nurse manager is extremely good at critical conversations. Her ability to not let anything go and to bring everybody together to talk about it. They all have, on this unit, they all share bathing. This is really interesting because they have a Volt phone. And so what they do at 2:00 in the afternoon is they Volt everybody and say, are all the baths done? If you need help, they put together every day a little bath team, which is a nurse, an RN, and a nursing assistant. If you can't get, Andrew, your patient bathed because you're so busy doing other things, they come in and bathe your patient.
No kidding.
No kidding. It is this kind of a unit, and they have high satisfaction. And it is simply because they talk. Now, I will say that if you talk to the nurse manager, it was very difficult for her to get a lot of her new millennial nurses to talk face to face.
Oh, yeah.
They would rather text everything, but they are learning, and you can go up onto this particular unit and you just feel this teamwork, and with their patient population, they need to get everybody up, and they just sort of all do it together.
So the skill that, if we could label that as a skill, perhaps for especially the new nurses that are listening, that takes a degree of emotional maturity to talk about, to talk about issues that might make you feel sad, angry, especially in the context of a unit where you feel like you might be treated unfairly, to open that up and discuss. And it sounds like
they have to feel
safe. Yeah.
And the manager has to feel safe from the aboves, from the physicians, for that they're protected too, because if you're going to try something different, then you have to have some of that authority too.
If you talk to this nurse manager, it was very difficult getting it going. And she said we would, everybody would be sitting around this table and nobody would say anything.
Sure.
And she said now people are very willing. They also have a system of recognition up there, and they have these little cards with smiley faces on them, and they hand them out to each other. You did a great job. So,
I noticed that you did that.
And they're really cool. And they say, one of the things that said their card says, saw you do that. Woohoo.
Oh, no kidding.
Saw ya. Caught you doing it. Caught you doing a good thing. Mm-hmm. Caught you caring. And it's taken a while, but it really takes an extraordinary nurse manager.
For sure.
And one of the things about nurse managers is that, and assistant nurse managers is that we do not train them. All of a sudden, they're a staff nurse, and the next day, hey, we need to be an A&M, and we don't train them.
And I think nurse managers, in my opinion, are the most important person on the team.
Because
they take the crapola that's
from above and below.
Oh, yeah.
And the crapola from below, they translate the mandates from the head shed down to the team. they translate the crap that's from the rabble, the staff, up to the
head shed,
and they stick up for people, and they take stuff that they're never
and
going to take.
There are demands on them for data keeping, and you've got to do this, and you've got to do this, and JACO is coming, and other spy agencies are coming, and the data that they have to keep is
it's crazy. And I bet what I see that the nurse manager has done is empowered her staff, empowered by saying, you guys have within you the solutions, and so consequently, probably she's set the culture. Right?
So I have a question for new nurses. How do you interview for a job? What do you ask?
That's a good question.
How do you assess
the culture and assess the leadership? Yeah.
What are you going to ask of your nurse manager? They are going to ask you lots of questions. But what do we need to advise new nurses to ask about their ethical climate at work? How do you address that?
Well, I would flat out help them say that. And I would get to, I will say that at our hospital, nurse managers interview new nurses always with one or two staff nurses. This is the pattern. It's a term. And one of the things that I don't talk to the recruitees, but one of the things that I know a lot of our nurse managers always ask is, give me your definition of team. What is team? A lot of millennials have difficulty articulating that. So one of the things that millennials should ask is, tell me about the team up here.
That would be
That's a great way to phrase it.
Yeah.
I would, if I was coming onto a unit, I would want to know who does the scheduling. That gives me an idea whether it's very maternalistic, one person does it, or whether this is a team and a group and, that kind of thing.
I would ask questions like, how are conflicts held? How do you handle...
That's a really good question.
How do you handle that here? And the other one would be, who are you looking for? Who's your, what are the characteristics of your best nurses here? Just to make sure that I have those attributes too, that this is a good fit for me, not that I'm just a good fit for you, that I'm not just a warm body on your shift.
I as a new nurse, I would want to know how they did orientation, how they choose preceptors, how they...
Oh, that's a big one.
All that kind of stuff. Because we fail to really understand how fearful new millennial nurses are, how inadequate they feel from we need to really support them. And this old baby boomer thing of, it's up to you to learn the job.
I did it. You suck it up.
We really need to work with our new millennial nurses. And we have this year-long grad residency program. And one thing that they're really focused on is, help me. I'm scared. And we fail to understand how scary this is for a new nurse.
Well, I was pretty scared in my first job in 1977.
But nobody really supported you, did they? No. And one of the reasons, another thing that we do in the hospital is you really, really need HR to really drill down and find out why people are leaving.
Yeah. And it's interesting because we started on the, the missed cares and the basics.
Missed nursing care.
Yeah. And so that seems like it might be a good place to end this time on, and how you see that in an exemplary unit. The way you described how there was a bath team who said that's important, an ambulation team that said that was important. So getting back to those basic nursing cares.
And it is a team approach. They use their phone. This is very high tech.
Right.
They use this phone. It's
a mass. It goes around their neck or something, right?
No, it looks just like an iPhone. It's an iPhone. And they use it for all kinds of things. There's an assistant nurse manager on one of the units who was presenting a nursing quality forum. And they are very concerned about this deconditioning of their patients. And he's a really bright, young, I hope he stays, kind of nurse. And he sends out these mass texts that say things like, move it. And what that means is, did you move your patient, get him, turn him.
Yeah,
also
range
all
of
of a
motion,
sudden they
everything.
get a little ding on their phone and it says, move it, move it.
So
you know?
that's the leadership that we're getting from the millennials.
Right.
You know,
That's so
that's
great.
And,
Yeah.
and it's
Yeah.
good. And you can only do that when
Right.
you have a good team.
Right. And move it. They, make sure that maybe you're not getting your patient up and ambulating them because you can't by yourself and you're scared to ask that nursing assistant because that nursing assistant, as Rebecca said, is harried and frayed. And, you have
Right.
to be able to quickly text on your phone, help room 2120 or whatever, need help. If we can help millennials understand, it is better to bug people for help than not do it because
Right.
you can't do it by
And
Right.
to
And
tell
this
the
is a-
boomers that it's okay to be asked for help and it's not a judgmental thing.
Most baby boomer nurses
Want to?
want to help,
Mm-hmm.
but this strange dynamic of millennials that I don't want her to see that I need help. No, it's all about the patient.
Yep.
Right.
Keep
I
it
love
focused.
that. And that
Yeah.
what a great way to kind of end our
For sure.
our time. It is all about the patient, and building teams. And that's where nursing leadership gets into the mix. And you guys have any closing things to say or just our usual send off?
I just think it's really important to remember why we're all there. One of the favorite things I love to do is when I'm with a group is say, why are you a nurse? And so that's what I would end with is, so why are you a nurse?
Mm-hmm. And keep your eye on the patient.
Andrew Witter's here is telling you to innovate, agitate, and educate.
Backing up what Andrew said, I think it is very, very exciting to me as an old baby boomer nurse that these millennials are going to come in here and I think change nursing. We
Change
may
healthcare.
not recognize bedside patient care in a few years, but it has to be the millennials. And hang in there. Don't give up. Please don't quit.
And don't just all go in to be a nurse practitioner.
Stay at the
Exactly.
bedside.
Exactly.
We need you. We need you.
All right. Thanks. This is Friends of Flo signing off.
Take care, everyone.
I think, bye-bye.
Friends of Flo is brought to you by NCLEX Mastery. Go to the App Store right now, download NCLEX Mastery, and before you leave, if you could just share this with your nursing friends, tell them about us, leave us feedback, go to our Facebook page, tell us what you liked, tell us what you didn't love so much, be nice. But thank you so much. We really appreciate you.